Start with a prayer again. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karavavagai Tejasvinamadiitamastu Ma vidvishavai. Om Shanti, Shanti, Shanti. Welcome back, everyone. Hope you all had a peaceful sleep last night. I'm really happy to be back with you all. I thank all the organizers and eminent professors for giving me this opportunity. In today's session, we are going to address mainly how we can integrate yoga therapy in behavioral therapy for COVID-19 related psychological complaints. It's quite a vast topic. I will try to make justice by trying to complete the whole session. In case if I can't, I might have to skip a couple topics at the end. Please bear with me and please follow me closely if you have any questions, particularly related to the topic. Let's stick on to the topic because it's a very vast subject. We are trying to integrate yoga into behavioral therapy. Behavioral therapy itself is a huge science on its own, and yoga is another huge science and ancient wisdom. So it's going to be really a tough task to complete the entire stuff. And today we are not going to just see based on the scriptures, okay, the scriptures say this, so that you have to do all these stuff like in yoga by which you can be benefited. We are not going to go that way. We are going to see the scientific foundations of these yoga techniques which have been followed for centuries, like from a very ancient time. So we are going to see how they are scientifically based. So this session will be mostly science-based. If you are not inclined to science, probably you might feel a bit boring this today's session. Please bear with me. End of the session, we are going to share some very important techniques. I might not be able to demonstrate everything, but I will definitely demonstrate those which are very important and relevant to the current technique. Of course, today we all are living in a very tough period. We all know living through the pandemic itself is really a tough task, but the shadow of the pandemic, which is going to be on the economy of families and the country, and also on the psyche of the individuals and families, it's going to be really difficult, and it's going to take much longer time to recover from this economic as well as psychological impact of this pandemic. Probably if there is a vaccine or something in place, some medicine in place, this pandemic is going to subside, like it's going to go. But the after effects of this pandemic on the economic front as well as psychological front, it's going to take much longer time than we expect. The Times of India has reported that there is a huge rise in the cases of depression and anxiety during the lockdown. It's obvious and it's expected. So we need to see how we are going to tackle them. So while countries around the world continue to mobilize to contain the spread of the coronavirus, mental health experts say we can't lose sight of another alarming issue, the long-term mental health impact the pandemic is going to leave on the society. So such public health emergencies like COVID-19 will have implications on both individual as well as society. On individuals, we have insecurity, confusion, emotional isolation, stigma other than our economic loss. and of course, job insecurity. On the society, definitely society is facing a huge economic loss from loss of lots of businesses, work and school closures, inadequate resources for medical response, deficient distribution of necessities, particularly deficiency of the PPE, personal protective equipment for our medical and healthcare providers, who are the main frontline people who are working against the spread of COVID-19. The main root cause of all these mental health problems, as we all know, is the fear and sense of uncertainty. We definitely don't know how long this pandemic is going to take before it ends, and how many people are going to be affected, and what are all going to be the implications of this pandemic. This sense of uncertainty definitely creates fear that causes anxiety in people. Of course, prolonged anxiety, of course, it's already almost 7 months now from the start of the disease. Even though it is quite recent that India is facing trouble. Initially, India was really doing good when we in North America, we were facing a real tough situation here. Then India was doing really good, but now here it looks like it's getting a bit better, but we are really worried about India now, where the number of cases are really going up. So we don't know how long it's going to take. This prolonged anxiety is going to definitely cause some frustration, leading to depression. So there are several behavioral therapies that to address the problems faced, the psychological problems faced by individuals. One main frontline therapy available nowadays is the behavioral therapy, cognitive behavioral therapy. They all are following certain cycles of our mind. Mainly the cognitive behavioral therapy follows this simple cycle of thoughts, provoking feelings, and behaviors are the results of the thoughts and the feelings. So when we follow such modern behavioral therapy, there are certain shortfalls. We need to fill those gaps. That's where we come into the integrating yoga into the behavioral therapy, which will give a more holistic approach in order to address the psychological problems faced by people. There are several psychiatric and psychological measures available in the modern days of management of these illnesses. Integrating the ancient wisdom of yoga along with modern behavioral therapies have proven very effective in augmenting the outcomes. There are numerous scientific research-based documents supporting the effectiveness of such integrated approach. The disclaimers, again, these are only for educational purposes and not a medical advice. Please do consult your doctor or therapist before starting if you have any specific complaints, existing complaints. COVID-19 has various other associated problems which needs multifactorial approach. These yoga techniques could be one of the most important part of it, but surely not all. In today's session, I have organized in the following broad sections: Yoga Integrated Behavioral Therapy, YIBT. We are going to see the psychopathological basics, the neurobiological background of the symptoms, and pathophysiological foundations in therapeutic interventions, and the techniques that we have chosen in yoga integrated behavioral therapy. Coming to the psychopathological basics, let's talk about anxiety. So what is anxiety? Is anxiety a disease? No, definitely not. Anxiety cannot be a disease. It is an emotion like love and affection, joy and compassion. Like any other emotion, anxiety is also an emotion. We need anxiety to perform better in a given situation. Like for example, I have anxiety right now. If I don't have the emotion of anxiety right now, probably I'm not going to do a good job here. So we all need anxiety as an emotion in a given situation, which helps us to come out and perform better every time so that the results are better. We can contribute better to our society. So anxiety is a normal reaction to danger, the body's automatic fight or flight response that is triggered when you feel threatened, under pressure, or are facing a challenging situation, such as a job interview, exam, or a presentation like what I'm doing now, etc. In moderation, anxiety isn't necessarily a bad thing. It can help you to stay alert and focused, spur you to action, and motivate you to solve problems. But when this anxiety becomes a disease, before seeing that, we will see the common signs and symptoms of anxiety. People feel nervous, restless, or tense, having a sense of impending danger, panic, or doom. This is what we all are facing nowadays with this pandemic situation. An impending danger and an uncertainty, having an increased heart rate, breathing rapidly, sweating, trembling, trouble concentrating or thinking about anything other than the present worry. So the main problem is this worry will take over the person. He cannot think about anything else other than thinking only about that particular worry. Having trouble sleeping, experiencing gastrointestinal problems. I've highlighted that point. I want you to note down. Why do you get gastrointestinal problem? If you had any prolonged anxiety, you have seen how it affects your gut. So why do we get gastrointestinal problem if it is just a psychological issue? There is some connection that which yoga utilizes to influence the brain. We will be discussing about it in this session today. Having difficulty controlling worry. So these are all the common symptoms everyone gets when in an acute attack of anxiety. But that becomes a disorder when anxiety is constant or overwhelming, when worries and fears interfere with your relationships and daily life. You are likely crossed the line from normal anxiety into the territory of an anxiety disorder. I'm sorry. So that fine line is very delicate. You never know when you are crossing that fine line. What we are trying to treat here is not a person's anxiety. It is a person's, if a person has an anxiety disorder. That is what people, any healthcare provider will tend to treat. So the common types of anxiety disorders, I think we can go a bit faster here. These are general idea, probably most of you will be knowing. Types of anxiety disorders: general anxiety disorder, GAD, which is very common, obsessive compulsive disorder, the panic disorder, social phobia, specific phobia, and post-traumatic stress disorder. These are all common classification and types of anxiety disorders. A prolonged anxiety disorder, if someone is facing a prolonged anxiety disorder, it eventually leads to frustration in life, and a prolonged frustration and prolonged worrying leads to this condition called depression. Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with a person's everyday activity. Like anxiety is not a disorder, but depression is. Clinical depression: one must experience 5 or more of the following symptoms over a 2-week period. So you can do a self-checkup now. So number 1, feeling depressed most of the day, loss of interest in most regular activities, significant weight loss or gain, sleeping a lot or not being able to sleep, either end, either this way or black and white. I'm sorry. Slowed thinking or movement, fatigue or low energy most of the days, Feelings of worthlessness or guilt, loss of concentration or indecisiveness, recurring thoughts of death or suicide. This is very important, the last one. People, in spite of having so much fortune and wealth, they still feel depressed and they can lose their life. So we will see certain techniques that we can follow from the yoga tradition, how we can counter these feelings of depression and suicide in this session today. So all the root cause of all these problems, whether it is anxiety, depression, frustration, the main root cause is this one, the stress. Stress can be defined generally as responses to demands upon the body. It is the body's reaction to a change that requires a physical, mental, or emotional adjustments or response. Here, I want you to note down this word change. It is the body's reaction to a change that requires a physical, mental, or emotional adjustment. See, we all are about to undergo a change. That change which we are not very comfortable with, that is our main problem of getting stressed. As long as you are in your comfortable zone, you don't feel stressed. But when you have to come out or outgrow from your comfortable zone, you probably feel stressed. That problem is mainly problem of getting accommodative to any changes. It can come from any situation or thought that makes one feel frustrated, angry, nervous, or anxious. Conceptually, stress can be any threat, either real or perceived, to the well-being of an organism. It's of basically two types. One is systemic, physiological. Other one is processive or psychogenic. In the systemic side, it is a real threat to well-being, physical, like when there is a real injury, if there is a real threat, physical damage, then whatever stress you are getting out of it is real and you feel the real. You can feel or see the damage happening. On the other side, it's processive. It depends upon one's perception. Quality of stressful stimulus depends upon the interpretation of the situation. It depends upon a person's understanding of the presenting situation. The severity of the stressor and its physiological impact can vary amongst the individuals. Like, right now, we all are having difficulty facing this pandemic, but there are certain businesses which are making real huge profit out of this pandemic. Like, say, for example, those who produce all these masks and other hand sanitizers and other stuff, they capitalize on the current situation. But many other businesses are struggling to make any profit. So it depends upon how you see a situation. So that is the psychogenic stress that many people are facing now. So there are 5 stages of stress. The first one, fight or flight, stage of damage control, stage of recovery, stage of adaptation, and stage of burnout. Fight or flight. It is important to understand these stages because you will know where you are in case if you have a stress problem, in which stage are you. Depending upon the stage, you can take the interventions. You can act accordingly. The moment I'm sorry. The moment you first feel stressed, oh my goodness, your body lets you know. It sounds the alarm. This alarm is very important, and everyone who faces stress will notice this alarm the body gives. And activity in the SAM axis. See, I'm going to talk about few axes here. You have to remember this is the first axis, SAM axis. What is that? Sympathetic adrenomedullary axis. This activity of this axis is increased. So what will happen? So when you don't pay attention to these alarms, other things within your body starts happening. There is an increase in stress hormones. This is what happens when this SAM axis is activated. So heart rate increases, blood pressure increases, and even a decrease in the short-term memory and feelings of stress, fear, anxiety, and depression all follows. Now, the flip side to all this is that in the alarm stage, your mental focus also tends to increase. Like how when I told that when I started presentation, I'm anxious and I had stress, but my focus increases so that I can give a better outcome. You know, we need it, but we have to come out of that stress and anxiety as soon as possible. Not for long, but initially. The stage is intended to solve an immediate problem and then return levels to normal. Stage 2, damage control. When your body feels stressed, it knows it. What happens then is does its best to keep things as normal as possible while your body works overtime. The SAM axis tries to combat with your stress level initially, but it doesn't support you for a long time. Then comes the HPA axis. What is that? Hypothalamic pituitary adenocortex axis. This axis is activated. What happens? And anti-inflammatory hormones, that's where cortisols comes from, are secreted in order to control the inflammation that's happening. This stage allows the body to continue fighting a stressor long after the alarm reaction dissipates. But this is not a long-term solution. It's a quick fix. Usually this HPA axis comes into effect maybe after 15-20 minutes. But that is also not going to last for long. It's a quick fix to keep things moving while issues are sorted out. Third stage, recovery. At some point, hopefully, you have acknowledged that you have been running a marathon at a sprint pace, and decided it's time to take a step back and rest and relax. When you begin recovery, your body does its best to return your internal systems to their original and healthy levels. In order to recover, though, you have to rest, sleep, and reduce overall output, something that's incredibly difficult for entrepreneurs. This is why it's imperative that as busy as you are, you literally schedule time to rest into your daily and or weekly schedule. Make time to do nothing. Stage 4, adaptation. Now, let's say you didn't listen to your body and you decided not to make time to recover. You have chosen to adapt instead. Essentially, what you are telling your body is that this level of stress isn't going to go away anytime soon. So what does it do? It begins to settle into the feeling of constant stress and adapts accordingly, except that doesn't necessarily mean it adapts in a good way. Please note down this point. It doesn't adapt in a good way. What you will start to feel then is everything from lower energy levels to a demolished self-esteem. You won't sleep as well. You might gain or lose unhealthy amounts of weight and be far less likely to manage your emotions. The final stage is burnout. Finally, should you ignore the first 4 stages of warning, you will eventually find yourself completely and utterly burnt out. This could mean everything from full-fledged depression to actually being hospitalized with health issues. You are your most important asset. If you don't keep yourself balanced, you will suffer mentally, physically, emotionally. Remember, it is not just you, but all your near and dear. So you have to preserve yourself first in order to continue the life as it is. Don't let yourself reach burnout. You will end up spending a lot more time getting yourself back to a healthy state than just doing a little bit each day to prevent that from ever happening in the first place. So we will see certain simple techniques that we can follow or incorporate in our day-to-day practice, which can fight or counter these effects of stress. We cannot avoid stress, however, in this given life. So we have to find out certain techniques to adjust and overcome the stress. There was one question asked to Sadhguruji once. Someone asked, like, how long I should sleep? Should I sleep for 8 hours or 10 hours? Like, people say sleeping for 8 hours is good for your health, or 10 hours is even good for your health, whatever it is. The question was how long I should sleep. He said, we are buying a car to use it, not to keep it locked in our garage. So if you're going to spend half your life sleeping, then it doesn't make any sense. So if all your systems are well and good, and if you get a good quality of sleep, probably 5 to 6 hours of sleep is more than enough. That's what he said. But are we all going to get that kind of quality sleep? I doubt. So we will still go with that 7 or 8 hours sleep, but still by doing all these simple techniques or incorporating them in our day-to-day life, we probably can at least avoid the consequences of the stress and depression. Coming to the neurobiological background. The neurobiological background is mediated through the autonomic nervous system, which has 3 divisions. Usually they say only 2 divisions, but it has actually 3 divisions. The sympathetic nervous system, the parasympathetic nervous system, and the enteric nervous system. So stress responses. Our body reacts to stress physiologically. It is not just psychological. It reacts to stress physiologically. Stress responses are affected by these 2 distinct but interrelated systems. As we saw before, the SAM axis, sympathetic adrenomedullary system axis. The other one is hypothalamic pituitary adrenocortical system. We are going to see about it in detail, because that is how we can understand how yoga can actually interact with these systems and cut down these stress responses. It's going to be more like a science hereafter. So the SAM axis system is component of the sympathetic division of the autonomic nervous system. So sympathetic division means it is fight or flight. Everything increases. Your heart rate goes up, your breathing rate goes up, your BP goes, everything goes up, and it prepares you in a given situation where you can react immediately and respond immediately to survive. So it releases the epinephrine hormone, it's adrenaline, from the medulla or center of the adrenal gland. Increases in circulating epinephrine facilitate rapid mobilization of metabolic resources and orchestration of fight or flight response. So now what happens? All the blood will move towards periphery. Like we get all the blood coming to our joints and bones and muscles so that they can act better. So it diverts the circulation from other internal organs, particularly abdominal organs. So that's how, when SAM axis is activated, it affects your gut activity. The other axis is HPA axis system. The HPA system produces glucocorticoids, the cortisol. That is a steroid hormone. Unlike epinephrine, which does not cross the blood-brain barrier to a significant degree, the brain is a major target of GCs. I've underlined this point because from our SAM axis, we get this epinephrine, adrenaline, which doesn't reach our brain too much, but this cortisol does, this steroid hormone does. And what it will, of course, it's going to prolong your ability to combat your stress and anxiety. But on the other hand, this cortisol hormone is going to also interrupt in your brain function. So that's going to impair your cognitive abilities. Also, unlike epinephrine, glucocorticoids production takes some time, approximately 25 minutes peak levels, and many of its impacts on the body and brain occur through the changes in gene expression. Consequently, the impacts of GCs are slower to develop and continue for longer periods, so that you can continue. Like this happens in stage 2 and 3 of the stress stages we saw. So you can continue fighting, but it will wait for you to respond positively. If you're not waiting, then it's going to give up too. So that is what happens. So due to the stresses are any situation, any stimuli that's going to cause strain to us, which you perceive as stress. So the first thing on the one side, the SAM axis, it activates the sympathetic nervous system. That activates the adrenal gland. The medulla means the inner side of the adrenal gland. Adrenal glands are the glands situated just above our kidneys, So that releases adrenaline and noradrenaline. The sympathetic nervous system itself can also release these hormones. So that prepares us for the fight or flight mechanism. It increases the heart rate, increases blood pressure, increased alertness, and increased lipolysis. It breaks down the fat and produces more energy so that your muscles are not deprived of energy for that quick response to the stimuli. On the other side, we have the HPA axis. The hypothalamus plays a very important role in balancing all these stress reactions, So when there is a stress, it activates the hypothalamus. Of course, it activates the hypothalamus to secrete this hormone CRH, corticotropin releasing hormone, which goes to the pituitary and stimulates pituitary to stimulate adrenocorticotropic hormone, which will in turn reach the adrenal gland, adrenal cortex. It is a covering upper layer of the adrenal gland to release cortisol, the main hormone, steroid hormone, which actually increases the energy compensations. It increased gluconeogenesis and increased lipogenesis. What does that mean? Once cortisol comes, it brings more energy, but it mobilizes energy from our own muscles rather than the fat. It actually improves fat accumulation and decreases your muscle mass. That is how people gain more fat with stress and anxiety. As we see, all this stress pathway is mainly through the sympathetic nervous system. How to combat, how to compensate, and how to balance. That's where this parasympathetic nervous system comes into action. The vagus nerve, we call it as the third axis, gut-brain axis. So to check the sympathetic activity, we have the parasympathetic nervous system, which is responsible for rest, relax, and digest. So what we saw before, all the circulation are diverted from our internal organs, abdominal organs, to the periphery, to the muscles, for the quick reaction. But now this is going to bring all the blood circulation to the abdomen so that it can improve the digestion. And it also is going to bring more blood to the brain and the respiratory and cardiac system so that we can rest and relax. One major nerve of parasympathetic nervous system is the vagus nerve. There is a huge scientific backup now, lots of research going on about this vagus nerve. Vagus nerve is the longest nerve in our body, starting from the brain stem and goes all the way to the gut, hence forming the gut-brain axis. It supplies almost all the visceral organs like lungs, heart, spleen, liver, gallbladder, pancreas, stomach, kidneys, small and large intestines. So that is the structure of the vagus nerve. That is the structure of the vagus nerve. You can see here, it starts from the brain stem here, Start from the brain stem, it comes out, there is superior ganglion and the inferior ganglion of the vagus nerve. And then it gives the pharyngeal and laryngeal branches. It supplies mainly the windpipe, that is very important. That's how you have to remember this, by doing Ujjayi breathing, we can influence this vagus nerve. We can tone up this vagus nerve. And then it comes down, it supplies through the cardiac branch and the pulmonary plexus, it supplies the lungs as well as the heart. And then it comes down beneath the diaphragm, and then it supplies through the esophageal plexus, it supplies the stomach, it supplies the liver, it supplies the spleen, it supplies the kidney, it supplies the colon, small intestine, large intestine, everything. So to simply remember simply what we say, heart and lungs above the diaphragm and everything below the diaphragm is supplied by the vagus nerve. But interestingly, if you notice, there are three cavities in our body. One is the cranial vault, cranial cavity. The other one is our chest cavity. And the third one is our abdominal cavity. This nerve connects all three cavities. It connects the brain to the respiratory system and cardiac system, and then to the gut. That is why this connection is called as gut-brain, brain-gut axis. So we can influence the brain through doing pranayama and other stuff. That is how the yoga uses the diaphragm and pranayama techniques in order to use our brain to produce a conducive situation where a person can go for some therapy. So influence of vagus nerve is known as increasing the vagal tone. By increasing the vagal tone, it decreases the heart rate, decreases the breath rate. Whatever happened opposite during the sympathetic stimulation, this tries to balance what happened in the initial stage of your stress attack. It increases the digestion and it improves the immune system. I'm sorry, I forgot to tell about this. When there is constant activity of the other two axes, the SAM axis and the HPA axis, and the secretion of cortisol through the HPA axis is going to impair your immune system. When you are stressed, you will be more prone to catch infections. Please note down this. By increasing vagal tone, we can once again improve the immune system. It calms down the mind. That's very important. It calms down the mind. We have to do something to calm down the mind before you go into any behavioral therapy or any psychological counseling if needed. Functions of the vagus nerve. It's opposite to the sympathetic nervous system. Main function is rest, relax, and digest. The management and processing of the emotions work directly with the vagus nerve between the gut, heart, and the brain. The GBA that is the gut-brain axis, is like a communication superhighway between the gut and brain. We get strong gut reactions to intense mental and emotional states. That's why, when we get intense mental or emotional state, that can disturb the functioning of our colon. So important link between nutrition, psychiatric, neurological, and inflammatory diseases. Functions of vagus nerves continues. Deficiency leads, this is very important, deficiency of vagal tone can lead to brain fog, fatigue, note down, anxiety, depression, poor emotional and attentional regulation, chronic inflammation, and immune issues. So now you will understand why it is important to tone up this vagus nerve, and it is purely through yoga we can achieve this result. Critical to overall health, as it is connected to almost all organs. Like as we saw in the anatomy, it's connected to all organs. It increases the serotonin turnover. That is another very important stuff, the serotonin. Reduced serotonin levels leads to increasing depression. Actually, doctors give special serotonin preparations, that is what the main line of treatment for depression is, what they call as SSRB, selective serotonin reuptake blocker, because they want the serotonin to stay in the circulation for to relieve the depressive symptoms, So we can, without taking any medication, we can increase the serotonin turnover through all these vagus nerve toning techniques from yoga. Can alter the HPA axis and regulate mood and behavior. So that's what, when you stimulate this alternative pathway of parasympathetic nervous system, it automatically calms down the sympathetic nervous system. So it calms down, it blocks the other two axes, the SAM axis and the HPA axis. Most important link between the abdominal, thoracic, and the cranial organs. Yoga and vagus nerve. Strengthening the vagus nerve is called enhancing the vagal tone, which is studied, validated, and used widely in the medical field. VNS, vagus nerve stimulator, is used in the treatment of chronic depression and epilepsy. I don't know how many of you know. This is a device used to stimulate the vagus nerve. In case of treatment-resistant depression and epilepsy, they are using now. Pathophysiological benefits of yoga are mainly from its influence on the vagal tone, strengthening the vagus nerve. See, that is the device, They have to do 2 incisions here. So they have 2. One is the pulse generator, which is situated, which is presented here near the neck, and the other one is the vagus nerve stimulator equipment. They make a small incision on the left chest and they insert it within the skin, and the wire goes there, and the pulse generator is attached to the nerve that goes to the brain. So they say this is less invasive, easy procedure to, like the patient will be given equipment in the hand whenever they are getting depression, or sometimes whenever they are getting an epileptic attack, they have to just take that machine near their neck, So it stimulates the vagus nerve, and then they will calm down, So once they remove that machine, it's going to come back, So this is the modern science that is using this vagus nerve stimulation placement machine in order to counter chronic unresponsive depression and epilepsy. So it is really fascinating to see how we can achieve these effects without using any such invasive procedures, through our ancient wisdom of yoga therapy. Coming to the biochemical, so far we were seeing the neurobiology. Now we are going to talk about some chemistry here. So that is what I'm telling you. So far, did we mention any scriptures, any philosophy? No. So yoga is, that's what yesterday I was telling to Sir's question. Yoga is a pure science. There is nothing to believe here. Everything is seen. You are doing things for a reason, which probably in between we all forget, the human beings forgot, and now we are probably reinventing whatever our ancient ancestors have done. So we are going to see the biochemical background of hormones and neurotransmitters. Hormones and neurotransmitters play an important role in the human cognitive functions. These are chemicals released by the neurons in the nervous system. Both sympathetic nervous system and parasympathetic nervous system brings about their influences through these hormones. All those effects of increasing heart rate, increasing blood pressure, increasing birth rate, everything actually they produce through releasing these hormones or neurotransmitters in the circulation. We are going to see few important hormones here. The first one, cortisol. So when cortisol is high, it's going to maintain you in anxious situation. You are going to feel fatigue. It's going to cause fatigue, inflammation and allergies, anxiety, poor sleep, insulin resistance, and immune suppression. This is what is going to happen if you are in a chronic anxiety or stress. On the other side, when there is less, of course, cortisol is also needed in a lesser quantity. If there is going to be low cortisol, then you probably will face problems like increased fatigue and inflammation and allergies. So dopamine is called as the love hormone. Developmental problems, schizophrenia, psychosis, possible increased testosterone production when they are high. When they are low, lack of motivation, focus, memory, addictions and cravings, low libido and increased testosterone, decreased testosterone, poor motor control and tremors. So these two, noradrenaline and adrenaline, are those hormones secreted by the sympathetic nervous system as the first reaction for any stress. So it increases the stress and anxiety, hyperactivity, increased blood pressure and pain. And on the other hand, when it's low, it causes lack of focus, energy, motivation, depression, and apathy. Insomnia, anxiety, stress, blood sugar imbalance, insulin resistant and allergic reactions are created by adrenaline when it's high, and when it's low, it's going to cause poor methylation, lack of focus, lack of energy, poor blood sugar control. So there are three more hormones. Glutamate, if it is more, it's going to cause neurotoxicity. That means it's going to actually damage the brain tissue. It increases anxiety, stress, decreased mood, sleep disturbances. And when it's low, it causes low brain function, poor memory, and fatigue. See, all that means you need these hormones in a balanced amount, not high or low. Serotonin is the most important hormone here. It causes, when it's high, it causes headache, mental confusion, sweating, shivering, hypertension, tachycardia, nausea, vomiting, muscle twitching, and tremor. When it is low, that's what happens when you are stressed, right? So when it's low, it causes depression and low mood, hot flashes, sleep difficulties and anxiety, carbohydrate cravings, and constipation. The last one is GABA, gamma aminobutyric acid. That, when it's high, it causes anxiety, tingling of extremities, shortness of breath, numb feeling around the mouth, throbbing heart. When it's low, it's going to again cause anxiety, hyperactivity, premenstrual syndromes, and sleep issues, mood disturbance, or anxiety and depression. The yoga hormones, mainly we are interested in these three specific hormones: the norepinephrine, serotonin, and dopamine. So when they are alone, they have alertness, concentration, energy, the norepinephrine. But in excess, norepinephrine can cause anxiety, impulse, irritability, everything, and it is also important to increase your attention. On the other hand, this dopamine, mainly when it is individually, it causes pleasure, reward, and motivation or drive. As I told you, this is called as the pleasure hormone. But it is needed to balance our appetite, sex, and aggression. The third one, the moderator, is the serotonin, which in itself causes obsessions and compulsions and increases the memory. But that balance these two, and ultimately the interaction of these three hormones brings about the mood regulation and proper cognitive function. That is why we need the hormones, at least these three hormones in balance in our body. So this is what happens when there is reduced level of serotonin. So when serotonin is reduced, automatically it causes a depressed mood. It can impair your sleep. It can overstimulate of stress hormones, which can result in anxiety. By producing depressive mood, it's going to impair everything. It's going to impair the basic relationships. It's going to impair the motivation. It's going to cause depressive thoughts. Everything is going to lead to ultimately a clinical depression. So yoga and serotonin. Serotonin is a neurotransmitter very much involved in your mood, the way you think about the world and even yourself. So it's so important. Serotonin helps with mood balance, and low levels of this important neurotransmitter can lead to depression. There are lots of antidepressant drugs on the market, which essentially increases levels of serotonin on the brain. You can actually boost your serotonin without taking any drugs. Yes, that's right. Yoga is a natural way to increase your serotonin and helps uplift your spirits. We will see how we are going to do all these stuff. Coming to the next one, we are going to talk some physics now. So far, we were talking about biology, and then we talked about chemistry, and now we are going to talk about some physics, oxidative stress and brain damage. We all know our cells are made up of atoms. If an atom has an outer shell that is not full, like in the atom, in the outer shell, we have electrons and protons, right? So the electrons in the outer shell, they have to be paired, That's how the shell is complete. It may bond with another atom if the outer shell is not complete, It may bond with another atom using the electrons to complete its outer shell. So it takes one atom from the adjacent cell's atom, These types of atoms are known as free radicals. Which atoms? Those atoms which have incomplete electrons on their outer cells. So that what they will do, they will circulate freely in our circulation, and they will easily take an electron from other cells, So it is going to cause damage to those cells. As free radicals steal electrons wherever they can, they leave their targets corroded. Free radicals are an irreducible waste product of our own cells. Respiration. When oxygen molecules split into single atoms that have unpaired electrons, they become unstable free radicals that seek other atoms or molecules to bond to. If this continues to happen, it begins a process called oxidative stress. This stress is different than the psychological stress. This stress is the physical stress happens at each and every of our body cells. Of course, it can also include our brain cells. Oxidative stress can damage the body cells, leading to a range of diseases and causes symptoms of aging, such as wrinkles. When it damages the brain cells, that results in cognitive aging, which will in turn impede the behavioral recovery. A person, when he is suffering from such physical oxidative stress, and if a doctor is going to refer him for a behavioral therapy, do you think he will be able to combat or cooperate with the therapist? I don't think so. This is what happens, how antioxidants reduce free radicals, So the first image here that shows a free radical. So this is how it has to be. Always the electrons should be paired in the outer shell. But if for any reason, if there is an unpaired electron, that will keep on looking for another atom to bond with, So the antioxidants are those substances which we have in our body, which will have lots of free electrons in their outer shells. They will donate one electron to this free radical, and it will neutralize the free radical, so that the amount of free radical reduces, and that will reduce the oxidative stress in the physiological level. Oxidative stress and the BDNF. This is another important thing, brain-derived neurotrophic factor. This is a protein that has so many benefits to the brain. This amazing protein has been called miracle grow for the brain by doctors and researchers, because it not only supports the survival of existing neurons, but also encourages the growth and differentiation of new ones as well. The BDNF helps the parts of your brain that control critical functions like memory, emotion, and executive function. So it's very important to have adequate BDNF in your brain for your brain to function properly. Higher levels of BDNF have been associated with a lower risk of dementia and even depression. Sorry. The cytotoxic free radicals can affect the BDNF levels, causing decline in the brain function. See, this is what happens due to the oxidative stress to our brain. So this is what happens. So the cytotoxicity, because of the oxidative stress, it actually degrades the membrane phospholipids, releases of superoxide, peroxides, and free radicals. That actually causes cumulative oxidative stress, which will decrease the BDNF levels in our brain. When the BDNF level reduces, it reduces the synapsin and the CREB. Don't worry about the CREB. It is adenosine monophosphate levels, So that when that reduces, it causes synaptic dysfunction and cognitive impairment. So it is very important to have this BDNF adequate in our brain. Oxidative stress, BDNF, and yoga. Antioxidants are the weapon of choice. So they are the molecules that fight the free radicals. They neutralize the free radicals. Antioxidants soak up free radicals like sponges, so soaking up dirty water. Regular yoga training can decrease free radical formation and increases the antioxidant system. And yoga should be considered one of the therapeutic methods for relieving stress and overall well-being of the brain and body. Yoga has been shown to actually boost the BDNF factor. So these are all research-based, So they have researched and found all these facts behind using yoga as an alternative system to combat all these stress. Effects of yoga on gray matter. Now we are coming to look into the anatomical background. Gray matter is a major, I'm sorry if I am boring, I need to explain all these background before going into the actual techniques. That's how you will understand why we are doing this stuff, so that your compliance might be better in doing yoga. Gray matter is a major component of our central nervous system that is involved in memory and speech. We all lose some gray matter volume as we age. This is an unfortunate truth, but it's not inevitable. Sometimes if you commit some mistake, your superior might ask, do you have enough gray matter? So that is how the gray matter is so important for our cognitive function. Studies have identified differences in gray matter volume between long-term mindfulness practitioners and control. Yoga meditation practitioners exhibit greater gray matter volume and fewer reported cognitive failures. Slowly my anxiety level is down now. I'm getting used to. Recently, a study looked specifically at yoga and found that controls, that is a control group in the study, displayed the well-documented age-related gray matter decline. With age, we all lose gray matter, while yogis did not, suggesting that yoga contributes to protect the brain against age-related decline. How amazing is that? We can reduce. See, one increased threat with the aging population is the Alzheimer's disease and the dementia. That is what most of the Western countries are suffering mostly from. So this, you forget who you are. That is a very worst thing to happen to any human being. It's okay to be dependent, but you have to be conscious about yourself, right?